Hello and welcome to yet another edition of COVID-19. Korea has recorded fewer cases on this Wednesday compared to the day prior, taking the daily tally to below 100. But a cluster infection at the southern port city of Busan looks to raise numbers tomorrow. And on the subject of greater numbers, Europe is seeking to contain a resurgence in cases that has been prompting tougher containment measures in that region. We'll start now with the numbers for today with our Kwon So-ah before sitting down with our Kim Han-il for more on related news here and elsewhere around the world. Now, So-ah, let's start with the situation over in Busan, as I just mentioned.
Yes, Sunny. More than 50 coronavirus cases were confirmed at a nursing hospital in Busan, but those figures were not included in Wednesday's tallies yet. So that figure includes 42 patients at that hospital and 10 medical staff. And one of the patients, unfortunately, reportedly died before the test results came out. Now, massive screening was conducted after a nursing assistant tested positive on Tuesday after showing symptoms since last week. And this means in total, 53 cases are linked to this single outbreak. And it is the first time the city of Busan is seeing a cluster infection of this size. And to put that into perspective, we have 53 domestic cases nationwide this Wednesday as of 12 a.m. And in the meantime, the number of imported cases remains in the 30s for the second straight day. And with that, Korea has a total of 24,889 cases, and the death toll stands at 438 with 4 additional fatalities reported in the past 24 hours. People remaining in quarantine, this number has decreased to 1,421, and we have over 23,000 people who made a full recovery from COVID-19. Now, if you take a look at our graph now, since last Wednesday, we are seeing ups and downs here, fluctuations from the double digits to the triple digits. Now, authorities are saying it's still a little too early to make a full assessment of whether the quarantine measures were effective over the recent 2 holidays, but they do mention that the figures appear relatively stable. And by region now, Gyeonggi-do province reported 31 cases, followed by 23 in the capital, Seoul, and 8 in Incheon. And there are also some sporadic infections here in other parts of the country. Again, here, just 2 cases in Busan because the massive cluster infection at the hospital has not been added to the figure as of yet.
I see. So do tell us more about the import cases that have been reported for this Wednesday.
Sure, Sunny. The highest number of overseas cases was reported in Gyeonggi-do province. If we take another look at our map here, because 16 cases here were imported cases, which means even more than domestic cases. And then here down in Ulsan, this is also an imported case. And the rest of the cases were detected at the nation's airport or seaport. And this Wednesday, we are seeing 13 cases were linked to entrants from the U.S. And speaking of the U.S. now has almost 8.1 million cases, with some 50,000 new cases reported in just a day, and 13,000 new infections are seen in Russia as well as in Argentina and France here. And we are going to take a closer look at France when Sunny connects to a journalist in Paris later on. Meanwhile, Spain has surpassed the number in Colombia, and if we take a look at the UK here, really even a higher daily caseload here. 17,000 cases were reported in just a day. Meanwhile, in Southeast Asia, we are seeing resurgences in Indonesia, which has now become the country with the 19th highest number of infections around the world, with some 12,000 fatalities. And those are the updates I have for now. I'll be back tomorrow with more. But before that, let's take a look at the total figure around the world. 38.36 million is the figure we're seeing here. See you back tomorrow, and back to you, Sunny.
All right, so thank you for that. I'll see you tomorrow. Right, staying on the local front, officials have resumed the free flu vaccination program, which had been suspended following revelations that the vaccines had been improperly stored. For more on this and other news here and elsewhere around the world, I have our Kim Han-il here in the studio. Welcome, Han-il.
Good afternoon.
Han-il, let's begin with the resumption of the vaccination program then.
Sure. The KDCA announced yesterday that free flu shots will be provided once more, starting with children under the age of 18, also senior citizens over the age of 75, and pregnant women. So senior citizens between the ages of 70 to 74 will have to wait until next week to receive their flu shots, and those 62 and over can get theirs the following week. However, the free flu shots are a limited time offer with deadlines in place. Infants who have never been vaccinated against the seasonal flu have to get their flu shots twice, and they have until April next year to do so. If you're pregnant, you have until April next year as well. For everyone else, they have until the end of this year. As you know, there's been a rising demand for seasonal flu shots this year amid fears of a twindemic of concurrent influenza and COVID-19 outbreaks. In fact, we're seeing some reports here that some clinics are already seeing a shortage of flu vaccines already.
Right. Hannah, meanwhile, a local pharmaceutical giant has seen some progress in its search for a cure for COVID-19, I hear.
Right. So earlier this week, Korean drug maker Celltrion has received approval for its phase 3 clinical trial for an experimental COVID-19 treatment. So with that, the company is on track to reach its goal of securing conditional approval for its antibody drug, CTP59, for emergency use by the end of this year. The drug is widely regarded as one of the most advanced antibody treatments currently under development here in Korea. Also, this drug is directed against the spike proteins of the virus to prevent it from latching onto human cells. In a statement, Celltrion said stage 3 trials will be conducted on some 1,000 asymptomatic COVID-19 patients and those who have come into close contact with the infected.
I see. Shifting our focus abroad, a U.S. media outlet is casting doubt on the efficacy of the first generation of COVID-19 vaccines which are currently in trial. Right?
That's right. So although we may be seeing the first working COVID-19 vaccines in the next few months, the New York Times article pointed out that they may only provide moderate protection. So even by next summer, those looking at to get immunized may only have a choice between several mediocre vaccines without a clear sense of how to choose among them. Right now, there are 4 drug makers currently in phase 3 trials: Pfizer, AstraZeneca, Moderna, and Johnson & Johnson. But they are not without margins of error. Even a vaccine that fully meets FDA requirements may only be 50% effective, with that being the FDA's target for a COVID-19 vaccine.
Staying with Johnson & Johnson, Hannah, I understand officials there have decided to stop their clinical trials. Tell us more about this.
Sure. Earlier this week, Johnson & Johnson decided to pause its phase 3 clinical trial after an unexplained illness found in one of the study participants. So the company did not elaborate on what this unexplained illness was, but said the trials were not under clinical hold, which is a more serious setback. And it is not immediately apparent if the volunteer received the actual vaccine or a placebo. So Johnson & Johnson said a study pause is a standard operating procedure in a clinical trial and expressed confidence in the safety of its vaccine. This is the second major setback reported on the vaccine front after AstraZeneca halted its phase 3 trials last month following neurological complications reported among one of its participants.
One final question, Hannah. China is another country where vaccines are in their late trial stages. I understand the country is strengthening ties with Indonesia for a joint COVID-19 vaccine program.
Right, so China plans to supply 100,000 COVID-19 vaccines to Indonesia as early as next month. The drug maker who is supplying these vaccines to Indonesia is CanSino, which is developing one of the 4 vaccines in the country that are currently in phase 3 clinical trials. Sinovac, another Chinese drug maker, vowed to supply 1.5 million doses to Indonesia in early November and another 1.5 million doses in December. Indonesia is not only a huge market for Chinese vaccines, it is also becoming a budding testing ground and a manufacturer for these vaccines. So volunteers in the Indonesian city of Bandung are already taking part in phase 3 trials for Sinovac. And Indonesian and Chinese biotech firms are teaming up for vaccine production by early next year.
All right, Hannah, thank you for that. I'll see you again soon.
See you then.
Right, calls for social distancing amid the pandemic have been aggravating plastic pollution as many opt for non-face-to-face delivery services which depend on single-use disposable packaging. In fact, to offer you a visible understanding of the amount of waste that can be accumulated by one household in a span of a day, we bring you this following report.
Hi, I'm Shinsebyuk. Well, as COVID-19 drags on, we are seeing a change in consumption pattern, which is more online shopping and food delivery. However, that inevitably leads to another problem, which is much more waste.
배달 음식 같은 경우는 그 플라스틱으로 된 그릇을 주더라고요. 그러다 보니까 플라스틱 그릇이 식구가 대여섯 명 되면 벌써 7, 8개 되고 그러다 보니까 쓰레기가 많이 나오더라고요. 택배 같은 경우도 종이 상자뿐만 아니라 거기에 스티로폼이며 뽁뽁이며 뭐 여러 가지들이 들어있어요. 그래서 요즘에 그냥 평소 쓰레기보다 훨씬 양이 많게 나오고 있습니다.
From now on, let's walk through an ordinary day together to see how much waste is generated in one day.
So these packages are what I ordered for today. And as you can see, there are different kinds of packaging materials, including vinyl, paper boxes, and styrofoam as well. And right now, I will start unpack those and see whether there are different kinds of cushioning materials inside here. So I unpacked them all, and most of them left a lot of waste behind it. Of course, some of them we can recycle, however, others we cannot. Especially these vinyls, we cannot recycle it, which would definitely do negative impact to the environment. Just to protect this tiny cosmetic product, you need a lot of cushioning materials, like another box inside a huge box and scrap paper to cushion it. If we were to buy this in person, we could have not generated a lot of trash. So now, how about food delivery? When we are ordering food, we can see a lot of plastic containers used to pack food. And now I am going to order some food. How much plastic waste would be generated?
Before the pandemic broke out, average households used food delivery services 3 times a month. And now it has jumped to 4 times a month, which can be cause for concern.
You can see most of them are packed inside plastic boxes. So this is stew, and I will be unpacking this. And once you open this, there is a plastic lid. And there is another plastic vinyl. Just a bowl of stew itself is already generating 3 trash. The plastic lid, the plastic vinyl, and plastic box. Imagine you have this meal for every day. It would generate a lot of trash.
This is my waste collection of the day, and it is just a lot. Indiscriminate use of plastic during the COVID-19 pandemic is causing a huge problem. Some even worry that there may be the so-called garbage fiasco.
The pandemic hit the world, and a lot of trash and waste are being generated across the world. And if we cannot reduce the waste because of the given situation, we at least need to manage it actively through recycling. And also, companies need to invent and develop eco-friendly materials and distribute them. This has been Shinsebyuk.
Over in Europe, restrictions are in place to tackle a disturbing resurgence in cases there. Health authorities in France recorded almost 26,900 infections this past Saturday alone. For more on the situation there, I have Lisa Louise, a freelance journalist based in Paris, live on the line. Hello, Lisa.
Good morning.
How are authorities there explaining the alarming resurgence in COVID-19 cases?
Well, the government is saying that most of the spread actually takes place amongst family members and friends. Now, there are a lot of restrictions here in place. You have to wear masks at all times, for example, here in Paris, outside in the street, but also on public transport at work. But once people get home, lots of them meet up with their family and friends, and that's where the spread takes place. Also, when you look at the different age groups, the government says that the spread takes place mostly amongst young people who, especially after the lockdown, felt they had to meet up again and party again. Although now cases of coronavirus are rising in all age groups here in France.
I see. Lisa, some observers claim that the resurgence is also owing to the resumption of cross-border travel in Europe. And if that is the case, do you have any idea on the numbers, perhaps, the average numbers for both domestic and imported transmissions in France on a daily basis?
Now, we don't have the same kind of figures as you have in South Korea. They're not spread up in domestic and international cases. But what we do know, what we can say about France especially, is that apparently during the holiday season in August, when France, the whole country, takes a break for several weeks, lots of people went on holiday inside France, not that many outside France. But whereas before that holiday season, most of the cases were concentrated in Paris and in the east of France. Now you can see cases spread across the whole country. So it looks like that this traveling inside France has really spread the coronavirus across the country.
I see. What have been some of the measures then taken by authorities there to better tackle the new outbreak?
Well, the government has declared different zones in the country. You've got, a red zone, a zone with a higher alert and the highest alert, such as here in Paris. And in these areas, different measures have been taken, such as, for example, in Paris, you have to wear masks at all times outside. And also bars have closed, and cafes and restaurants are to close, actually have to respect strict sanitary measures. Also, the president is going to talk tonight, Paris time, Wednesday night, and announce new measures. There's a lot of speculation going on about that, but it looks like that he will declare in certain hotspots, such as Paris, Marseille or Lille, as certain additional measures, which could be a curfew, for example. So a lockdown at night, the prohibition to go outside between, for example, 8, 10 o'clock at night and 6 o'clock in the morning. But the exact detail will still be announced tonight.
I see. Lisa, has a mask mandate been announced for the entire country, or is that just for the city of Paris?
No, that really depends on the city. Certain prefects have taken, either the measure to say you have to wear masks everywhere all the time outside, or in certain parts of our city, for example, the crowded pedestrian zone. Here in Paris, at the beginning, you had certain zones where you had to wear masks, but it was so confusing. There were no signs whatsoever where to wear those masks that the local government then decided to impose this rule everywhere in Paris.
I see. How is the public responding to the latest resurgence and to the measures in place to better tackle it?
Well, you could say that there is a certain coronavirus fatigue here, but also in other countries. Many people are kind of sick of the situation. They say the government, yes, they have taken measures, but it's really not very structured. When you look at the mask situation, for example, at the beginning they were saying they're not really of much use. You don't have to wear them. And suddenly we have to wear them everywhere. Also, in certain places, bars or restaurants have to close at a certain hour. And lots of people are saying, what does that mean? So the virus doesn't really spread after 10 o'clock at night. So it looks like, lots of the French feel that the government is not really in charge of this. And this is exactly what the president wants to change tonight when he speaks on television. He will, on the one hand, announce new measures, a clear horizon of these measures, say for how long they will be in place, but also say to the people that they have to cooperate in order to limit the spread of the virus.
All right, Lisa, thank you very much for that and for making the time to join us live at this very early hour over in France.
My pleasure. Thank you.
looks like I'm immune for, I don't know, maybe a long time, maybe a short time. It could be a lifetime. Nobody really knows, but I'm immune, so.
It's been about 12 days since US President Donald Trump's COVID-19 diagnosis and about a day since White House physician Sean Conley wrote that Mr. Trump has tested negative for the virus on consecutive days. Now, during his treatment and after, the US leader has sought to share his thoughts about this global disease with the public. And in today's session, we take a look at some of his words and more. I have Director Kim Moon-gyu of the ODA Center at the Yonsei Institute for Global Health. Welcome back, Director Kim.
Nice to meet you again.
And I also have Professor Lee Hyun-sang from Yonsei University. Good to have you back, Professor Lee.
Thank you for having me today.
And joining our talk virtually is Professor Park Ki-bom from Harvard University, all the way in the US. Hello, Professor Park.
Good to be back.
Right, Director Kim, 1 week after his 3-day hospital stay, President Trump returned to the campaign trail with a rally in Florida late Monday, where he claimed he is immune and he offered to kiss the crowd as well. Now, as a doctor yourself, do you believe that he is no longer contagious with COVID-19?
Well, I have to say, according to the research results until now, and briefly I want to remind that COVID-19 is contagious even before getting symptoms, like 1 to 3 days before developing symptoms. And as everybody knows that there's an incubation period, average about 5 to 6 days up to 14 days. And they say that replication competent virus does not show anymore after 10 days of the first symptom. So I think President Trump was positive for COVID-19 at the 1st of October, and he was antibody positive at the 7th. And then, well, I think he spent 10 days, but it's always, we have to be cautious. And he didn't went through the natural course of COVID-19 because he was treated with some kind of monoclonal antibody. I think if it's effective, you may say that he is not contagious anymore, but I don't understand that it's too early. I think it's too early to make conclusion for that. Yeah.
I see. Professor Lee, there also appears to be some dispute over the COVID-19 test that Mr. Trump took, with critics claiming that the rapid antigen tests, if I'm correct, that he's been taking are less accurate than the more sensitive PCR swab tests. Could you tell us more about this?
So the test kit that President Trump used was the Binax Now COVID-19 antigen testing kit. That was developed by Abbott, the American diagnostic company. And basically it gives a result about the presence of the antigens, which shows the presence of any of the particles from the virus. Although it had been approved for the use, and it has shown quite high sensitivity and specificity as well. But certainly it is not the gold standard when you try to confirm that the patient is clear of the virus, which is actually the recommendation of the CDC. So it is real, and even though it gives a good result, fairly good result, compared to its $5 cost and giving the test result in 15 minutes. So there can be situations where you cannot use the RT-PCR test. Then it can be a good alternative. But to test the final confirmations, to give the final confirmation of the negative status of the President of the United States, I'm not sure if it would be the best choice to go with this $5 test when you have the real-time PCR test available. because real-time PCR test, it amplifies any of the genetic materials in the serum. So at later stage of the infection, when the viral load is low, I think the choice would be certainly the RT-PCR test. So it is a little absurd that the White House is relying on the antigen testing kit.
Right. Meanwhile, Professor Park, among US media outlets, there is also much focus on the fact that the White House has not shared the timing of Mr. Trump's latest negative test before his October 2nd positive diagnosis. Could you elaborate for us, please?
Yeah, I'm happy to do that. I just want to add to what Professor Lee Hoon-sang just said about the testing and how it's unreliable, the rapid test. Can you imagine a metal detector for the White House that misses 10% of the guns, right? That you would never accept that, but that's exactly what the White House has been doing as far as testing. I totally agree with Professor Lee. So let's talk about why it's important to know when was President Trump's last negative test. It really has to do with contact tracing and how much risk people around him has had. It helps narrow down the scope of contact tracing. So we know that his first positive test was late October 1st, right? It was a Thursday. He developed symptoms the following day, and he received supplemental oxygen and then was transferred to Walter Reed on Friday. We know that he could be contagious, like Dr. Kim said, 2 to 3 days prior to even the onset of symptoms. Well, he had a lot of contacts during those days, Tuesday to Thursday. We all saw the debate on Tuesday with President Biden in Cleveland. He went to a massive campaign rally on Wednesday in Minneapolis. Then he went to a fundraiser in New Jersey on Thursday. That very evening, he got tested and he was positive. If the president had a negative test, let's say on that Wednesday, then the contacts from that Wednesday and then prior to that day were not at risk. So this is very important. If I had been in close contact with President Trump on Wednesday, I would want to know if he had a negative test that day, because that would make a difference between me being quarantined for 2 weeks or not.
Right. Professor Park, what are your thoughts on calls for different isolation timeframes depending on the severity of COVID-19 symptoms, which appear to have been the case for the US leader as he spent about 3 days in hospital?
So there's two questions, right? One is the length of hospitalization, which depends on his clinical symptoms. But I think the question you have is specific to the length of quarantine and when is it safe for anyone to be reintegrated and have contact with people. So President Trump will qualify as a mild case, in which case you have to have 3 conditions satisfied before you can be out and about. First of all, at least 10 days has to have passed since the onset of symptoms. I think he fits that. The second is that he has to be at least 24 hours symptom-free without using any medications to reduce his symptoms, such as fever-reducing medications. We're not sure if he's still on steroids or not, but that could potentially reduce some of the symptoms. And then the other symptoms have to be improving. So I think that the Dr. Conley and his medical team has cleared him for obviously going about and doing his campaigning. If he had severe disease, that changes everything.
Right. Director Kim, as I mentioned earlier, President Trump claims that he is immune to the illness now, and this remark was made online before he made it at the rally in Florida late Monday. And this remark, of course, was flagged by Twitter for misinformation. What is the official medical stance on immunity and COVID-19? Just out of curiosity.
Well, I think President Trump is insisting his immunity because his antibody test was positive. But there are 2 main cells for our immunity in our body, as everybody knows. That the first one is the B cell that produces antibodies, and we have another one called T cells, which is plays a major role for cellular immunity. And until now, the researchers says that antibody against COVID-19 from the survivors, they say they maintain about 3 months. And what happens after 3 months, we don't know yet. So we are waiting for the results. And COVID-19 belongs to beta coronavirus, which also contains MERS and SARS. And there's plenty of evidence that they have a similar, they might show a similar clinical course. So reinfection is possible. So even though you have antibody, even though you survived, you still have a chance to get reinfected. So persons like the president should be cautious every time. And we have to wait for more research to make conclusion about that issue.
Right. And speaking about reinfection, Professor Lee, at least 34 White House staffers and contacts have tested positive for COVID-19. And given this unfortunate scenario, how safe is the president at his headquarters?
So indeed, reinfection is not a whole lot impossible, as Dr. Kim said, and also especially with some of the reported reinfection of cases of COVID-19. So also, depending on the health status of a person and also the immunity of the person to develop neutralizing antibody level, we cannot absolutely rule out the possibilities. Also, with President Trump's being over 70 years old, more than 70 years old, and with his somewhat of overweight status, one ought to be more on the more cautious side in terms of, especially considering the fact that he is the president of the United States.
Right. Professor Park, is there reason to doubt the words of White House physician Sean Conley about President Trump's health, do you think?
Well, I think it's pretty clear that he has serious credibility issues. First, let me just make sure that we all thank him and his team for taking such a good care of our president. The fact is he's alive and well, and so his team did a great job. Having said that, there's been sort of several incidents which sort of cloud his credibility. The first one has to do with when he gave his press briefing, and he gave a very upbeat briefing. And this was immediately countered by the White House Chief of Staff, Mark Meadows, and saying, wait a minute, the president was quite sick the other day, and he was quite serious. So there was a sort of this inconsistency. Then he put out a press release about the timeline about his disease, and it was different from what had actually happened. And this was my favorite. He actually said that the president received a monoclonal cocktail from Resurgence in his press release, not Regeneron. And Regeneron is a South Korean cosmetic company. So it's been sort of disappointing to see this kind of inaccuracies and misrepresentation. So I think at the end, there's been a sort of a conclusion that he's more of a spokesperson for Donald Trump rather than a doctor being a professional caretaker of his medical needs.
Director Kim, Mr. Trump also revealed online that COVID-19 is less deadly than the seasonal flu. Now, these words were blocked by both Twitter and Facebook. For the sake of clarity, could you compare for us the fatality numbers for COVID-19 and the seasonal flu, please?
If we say about the mortality, definitely COVID-19 is higher compared to seasonal flu, which is 3.4% about, and seasonal flu is less than 1%. And the initial symptoms are almost same, except that the COVID-19 has lots of smell and taste. And COVID-19 virus is very pro-inflammatory. So sometimes, rarely we see a patient with multi-system inflammatory syndrome, which is not found in seasonal flu. So that's the difference. And if I add one more, COVID-19 has some kind of chronic fatigue or mental problems, and we call it long COVID. And it's not common. I don't think we have found that in seasonal flu. So why did President Trump said it's okay? I think it's kind of a subjective evidence, and because he went through that monoclonal antibody therapy, that might help a lot because it was introduced that the drug in the early stage of disease, and nobody's using monoclonal antibody for flu right now, so it's not possible to compare.
Right. Professor Lee, what impact does President Trump's response to the pandemic look to have perhaps on global containment efforts?
I think the influence of the president of the United States, I think, is immense, as we are seeing, especially in the situation in the United States, especially considering the messages that he is sending with many of the incorrect messages. And sometimes he himself is giving incorrect information or misinformations. He has been repeatedly saying that COVID-19 is not a serious disease. And also, upon his return in a very publicly staged, extravagant return, the first thing he did was taking off his mask. I think any of these kind of images and actions, I think it just speaks so immensely to his country and also to globally as well. Especially when the United States is a country which is producing one of the highest number of the COVID-19 confirmed cases with such a high mortality. I think it is such absolutely not the time to be on that side. So I think what President Trump is doing is exactly the opposite of what the President of the United States ought to be doing. So it's quite concerning.
Right. And just out of curiosity, Professor Park, over in the US, what is the response, the public response that is, or even those from the medical circles like the one that you're in right now, what is the response to President Trump's attitude towards COVID-19?
Well, Professor Lee really said exactly what I was going to say. We're really disappointed. He's using these long-standing and highly respected agencies like the FDA and CDC for political reasons, and he's playing with people's lives. And relying on highly expensive therapeutics and vaccines, that is not the way to manage a pandemic. That is that's only useful when you actually get the disease. And the public health response, the social distancing and mitigation measures, we botched that up. And those are low-cost, practical solutions. And so to rely on these highly expensive treatment is really a disappointment.
I see. Director Kim, you've mentioned the treatment that President Trump received while he was sick, that is, and we are aware that he received a mix of 3 drugs, and you mentioned one of them, the experimental therapy based on antibodies. Could you tell us more about this treatment?
Yes, it's still on phase 3 trial, as far as I understand. And if you go to the clinical trial, there are about 4,000 trials going on right now, and it's one of them. And the company called Resurgence took the blood samples from the COVID-19 survivors, and they found some few antibodies what might be therapeutic, and they choose 2 of them, and it's a cocktail of that 2, and they make a monoclonal antibody out of it. And they found out that if you give that drug in the early phase, it's very positive. I mean, symptoms get relieved easily, and some high-risk patients might pass that critical time very easily. So it's mostly effective in early infection and still going on to treat that drug with some severe cases also. It's not a homemade antibody. I mean, it's not made inside your body. It's going inside from outside. And usually the antibody has a half-life less than 4 weeks. So this monoclonal antibody is going to have a half-life, which I cannot recognize right now. And since President Trump has his own antibody, we have to check that if it's going to stay for how long period of time. So if that effect of drug subsides, people might get a reinfection. So Trump is still exposed to a risk for reinfection. And it's because of that the research for vaccination is still necessary, and still we have to take care of high-risk groups before they get exposed to COVID-19.
Right. Right. Staying with that experimental drug, Professor Park, I am aware that the drug was extended to President Trump based on a compassionate use request from his doctors. It is yet to be authorized by the FDA. Could you tell us a bit about this?
Right. So compassionate use is when it's requested only when it's not approved for its use, but the doctors determine that it's a reasonable thing to try as a last-ditch measure. It is not something for, President Trump wouldn't have qualified as a sick patient. It's usually for the sickest of the sick patients at the last-ditch effort. What they're trying to get, the Regeneron, is a emergency use authorization, which is more of a, once they get that, then the physician, it's not getting an FDA approval, but it's on an emergency basis. So that's much more widely used. But a compassionate use is case by case. So that's not very practical, but they have applied for emergency use authorization.
I see. Professor Lee, I was wondering, I'm going to ask this to Professor Park as well, but here in Korea, we are encouraging members of the public to get their flu shots. In fact, as I spoke with Kim Han earlier in the program, the free flu vaccination program has resumed here in Korea as of yesterday. Would you also recommend that all those possible, that is, in the country, get their flu shots this year?
I would recommend it, especially because when the flu season actually, I think the flu season already begun. Doctors are seeing some of the flu cases right now. The difficulty comes when it becomes difficult for doctors to distinguish between the cases with fever, whether it might be a flu or COVID-19. So I think it is in general sense, I think it is recommendable to get a flu shot. However, I think right now the Korean government has secured about 30 million flu shots. So it's not available for everybody in the country. So I think what we have to be a little bit careful is rather than rampant recommendation for everybody at the same time, I think there should be some prioritizations for the elderlies and for the some of the people with underlying conditions, health conditions such as diabetes or other chronic disease, and also people in the long-term care facilities and the healthcare personnel. I think those people should be prioritized for the vaccinations. But if the vaccine is available, I think in general sense, I think it's still very recommendable.
I see. Professor Park, polls in the US show that quite a number of people have revealed intentions not to get COVID-19 vaccines once they become available, and some are even talking about not getting flu shots this year. Do you suppose all this reaction is because of perhaps the fall in public confidence in health institutions in the US? What are your thoughts?
Well, there's a couple of issues. So first of all, the US has this sort of a libertarian, mentality. They love to own guns and don't tell us what to do. And that's part of that, sort of anti-vaccine movement. And it puzzles me as a public health practitioner why everybody wouldn't get vaccinated, but it's a reality in the U.S. As far as the credibility of the health institutions, let's just talk about the FDA. The FDA, when the director, Han, he actually came out with when the convalescent plasma study and they approved it, he exaggerated the benefits of this plasma, the treatment, and the next day he sort of backtracked it, and that did a lot of damage for his credibility. And I'm sure he's under a lot of pressure from the White House to try to make sure that these treatments are coming down the pike as quickly as possible, maybe even before the election. I will tell you, though, there's been a development where they just issued the guidelines for the vaccines, which pretty much seal the fate that the vaccines are not going to be available before the election. And of course, President Trump tweeted out his, dissatisfaction with Director Han, but that was the right thing to do. And then I think the drug manufacturers, the vaccine manufacturers, the 9 CEOs of these companies, they saw what was happening in the public confidence, and they decided to actually sign a pledge amongst themselves and saying none of them will actually submit for FDA approval until they know, and they amongst themselves, that it is safe and effective. This sort of gives you an idea of where we are in the U.S. with with the credibility of our oversight mechanism.
Right. Director Kim, do correct me if I'm wrong, but I understand that the words of wisdom in the medical arena is that every drug has its fair share of side effects. Now, keeping this in mind, in what direction do you suppose efforts to find a vaccine or cure for COVID-19 should flow?
Well, always when we think about vaccination, there are two conditions. It should be safe and it should be effective. And for coronavirus, it's very difficult to make a effective vaccination because we have a long time experience that failed to make a proper vaccination. And all the global pharmaceutical companies are trying their best, doing their best to make COVID-19 vaccination. And if we don't have a proper vaccination in a short period of time, there are other options that might be thinkable, like tuberculosis vaccination or measles vaccination, or even flu vaccination might be a bridge vaccination to prevent people, the high-risk people, getting COVID-19.
I see. All right, Director Kim, as always, thank you for being with us today. Professor Lee, thank you for your thoughts. And over in the US, Professor Park, thank you also for answering my impromptu questions.
It's my pleasure.
Right, well, that is all the time we have for today. Do tune in tomorrow at the ZAR as we take a closer look at the global plight of plastic pollution amid the pandemic. In the meantime, do take care and thank you for watching.